In this video, we discuss the problem of fungal nail infection, also known as Tinea Unguium or Onychomycosis. This disease can affect the fingernails and toenails, although it is more common than the fingernails. Fungal nail disease is not just a cosmetic problem, it affects your life and self-esteem. We begin by examining the types of fungi associated with these diseases. Knowing the pathogens is important for prevention and treatment. We also discuss how these fungi grow and spread, as well as the different ways you can become infected. Next, we will provide information on preventive measures you can take to reduce the risk of developing fungal nail infection. Prevention is key to avoiding the risk and potential complications associated with these diseases. At the end of the video, we will discuss the treatment options. Ringworm treatment varies depending on the severity and extent of the infection. We review topical and oral antifungal medications, including effectiveness, application methods, and side effects. In addition, we will look at lifestyle changes and home remedies that can complement medical treatments. By the end of this video, you will know more about fungal nail infections, from causes and symptoms to prevention and treatment strategies. Whether you are dealing with a current illness or want to avoid it in the future, this video will provide you with valuable information. Let's get started. Onychomycosis, or Tinea Unguium, is very common. It is estimated that about 7 to 10% of adults suffer from these diseases. Although these diseases are harmless and do not cause serious problems, they can reduce your life and self-confidence because the nails are disfigured and look bad. Fungal infection of the nails can cause discoloration, thickening, and cracking and breaking of the nail. Therefore, it is important to treat them in the first stages. If it is not treated in time, it will be very difficult to treat because the natural fungal infections of the skin cannot penetrate well into the nail. Some types of drugs are used for advanced onychomycosis, which we will discuss in this video. Now let's talk about the fungi that cause these toenail fungus and how you can get them. These infections are caused by fungal growth in, under, or on the nail. Fungi thrive in warm, moist environments, and these environments allow them to thrive. Fungi also cause toenail fungus, athlete's foot, and ringworm. These fungi belong to a group called dermatophytes. Trichophyton rubrum is the most common dermatophyte involved in onychomycosis. Other dermatophytes may include T. interdigitale, epidermophyton, T. violaceum, and microsporum. Fungi on or in your body can be fatal. If you come into contact with someone who has a yeast infection, you can get these infections. You can also get these diseases if you walk too much with bare feet and touch the soil or water. If you have diabetes or are over the age of 65, you have fungal nail infections, you have a disease that affects blood circulation. Swim in the pool. Claw damage. The skin around the nail is damaged. Long wet fingers and toes. The immune system is weak. Wear shoes with a closed toe, such as tennis shoes or boots. Now let's discuss the nature of onychomycosis and the symptoms you may experience. Fungal nail disease can involve part of the nail, the entire nail, or multiple nails. Common symptoms of nail fungus are uneven nail that can raise the nail bed, the smell that comes from an infected nail, a brittle nail or thick nail. Fungal nail disease starts as a white or yellow spot under the tip of the nail or toenail. As the fungus progresses, your nail will become discolored, thick, and have a chipped edge. It affects many nails. If you see a dermatologist, he or she can confirm the diagnosis by performing a few simple tests. A nail clip or file is removed and examined under a microscope. If fungi are found, the disease can be determined. A culture can also be used to identify a particular type of fungus. Now let's look at how to treat these fungal nail infections. The main treatment is an antifungal medication taken by mouth or applied to the nails. The treatment of fungal nail infections takes several months or even a year because it is very difficult for these antifungal drugs to penetrate the nail plate. These include drugs such as itraconazole, efinaconazole, terbinafine, cyclopyroxylamine, and amorolfine. If you have a mild infection, you can use over-the-counter antifungal creams, ointments, or lotions, and avoid oral antifungal medications. Nail polishes containing cyclopyroxylamine and amorolfine are used as the first line of treatment. Cyclopyrox comes as a solution for use on the nails and the skin around the nails. It is usually used once a day, usually at bedtime. Cyclopyrox topical solution works best if you trim your nails during treatment. Before starting the treatment and every week during the treatment, you must remove all the loose material from the nail with a nail cutter or a file. Apply to the nails and the skin under and around the nails. Be careful not to let the solution come into contact with other parts of the skin, especially in or near the eyes, nose, and mouth. The most important thing in this treatment is to continue using the nail color for at least 6 months to 1 year to achieve complete treatment and prevent recurrence. Amorolfine nail color is used in the same way and at the same time. Studies have shown that cyclopyroxylamine is more effective than amorolfine, but results vary from patient to patient. Efinaconazole, a new antifungal drug, is a new treatment for the topical treatment of onychomycosis. This substance is supplied as a 10% solution, which easily penetrates the nail plate and even the nail plate. For full recovery, it is recommended to use this solution daily for 8 to 12 months. For severe ingrown toenails or if your nails are completely broken, you may need to take oral antifungal medications. Oral medications are the most effective treatment for onychomycosis. The most commonly used oral medications are griseofulvin, terbinafine, itraconazole, and ketoconazole. Terbinafine in a dose of 250 milligrams is used daily for 8 weeks for nail fungus and 12 weeks for toenail fungus. Itraconazole is considered the most effective oral antifungal agent for the treatment of fungal nail infections. The dose of itraconazole is 200 milligrams once a day for 6 to 12 weeks. Itraconazole is also prescribed in burst doses, including taking 200 milligrams twice a day for 1 week per month, for 2 to 3 months for nails, and 3 to 4 months for nails. Please note that I cannot prescribe these oral drugs in a video because of the possible side effects. It is always recommended that you consult a dermatologist or doctor before starting these medications. Side effects may include headache, diarrhea, skin rash, or elevation of liver enzymes that should be monitored. Fungal infections of the nails are related to fungal infections of the feet, known as Tinea Pedis, and fungal infections between the toes, known as athlete's foot. I will be making special videos on these topics, so please subscribe to our channel for alerts. Well guys, that's an overview of fungal nail infections, including Tinea Unguium or onychomycosis. We have explored the various aspects of this disease, from its causes and symptoms to prevention methods and treatment options. I hope this information was useful and informative for you. Knowing this information can make a big difference in managing and preventing fungal nail infections. If you found this video helpful, please share it with your friends, family, or anyone you know who has nail fungus or wants to learn more about nail fungus. Your support in spreading this knowledge will help others take steps towards better nail health. Remember that nail fungus is not just a cosmetic problem. They can affect your quality of life and self-esteem. By staying informed and taking preventative measures, you can reduce your risk and fix problems quickly. Join our YouTube community to support our channel and get the latest news, tips, and treatment tips. By subscribing, you'll receive alerts on all of our new content, including upcoming videos on related topics like athlete's foot, skincare, and more. General health advice. We also offer exclusive content and other perks from our Patreon page. If you want to dive deeper into specific projects or directly support our work, a Patreon membership can be a great way to do so. Your support will help us to publish useful information and information. Thank you very much for watching and participating in our videos. If you have any questions or topics you'd like to discuss in future videos, please leave a comment below. We love hearing from our viewers and finding ways to add more value to you. As you can see in the following video, we are here to explore important health topics and give you practical advice. Until then, Take care and stay healthy.